importation of the virus as part of enhanced measures to contain the spread of the COVID-19 pandemic. Despite the closure, the government had several arrangements to evacuate stranded Ghanaians who underwent a 14-day mandatory quarantine to determine positive or negative cases to avoid community spread. However, many stranded Ghanaians who could not afford the fee for the 14-day mandatory quarantine, especially in hotels, were constantly putting pressure on government to open up the borders. Notable groups also argued that the closure of the border had restricted the movement of people, goods and services, and closed non-essential businesses. Hence, the president should listen to the plea and open up the country's airport. President Akufo-Addo on September 1, 2020 announced Ghana's decision to open up its air borders, but under strict monitoring and a testing regime.
Fellow Ghanaians, in update number 15, I announced the easing of restrictions in some areas of national life. I also indicated my hope that preparations and simulation exercises underway, including the installation of COVID-19 testing facilities at Kotoka International Airport, would give us a clear indication as to whether or not we could reopen the airport on 1st September. After weeks of thorough work, I'm satisfied that it's safe to do so. Fellow Ghanaians, I'm glad to announce that Kotoka International Airport will reopen and resume operations from Tuesday, 1st September 2020. This decision has been communicated to all international airlines.
The setting up of an installation that had the capacity to test every passenger who arrived at the Kotoka International Airport.
Ghana Airports Company contracted Frontiers Healthcare Services to provide a COVID testing at Terminal 3. We were looking for a partner or a concessionaire, a service provider who would be highly resourced, but of course also with people with the expertise of providing the solution that they would prescribe. And so the highly resourced entity comes from the fact that we knew we wouldn't have time, we wouldn't have a long time to deploy whatever we have to deploy. So we were looking for that highly resourced person willing to quickly mobilize, to deploy the infrastructure and the testing machines that will be needed for the service. So after combining all these three factors, Frontier came on top and we chose them.
Frontiers Healthcare Services has a rich heritage. We belong to a global group of companies with track record all over the world and delivering excellence in different areas of business. And healthcare is one of our core areas as well. So our parent company has presence in Nigeria, in other countries like the Barbados, in Zimbabwe, in healthcare. That's healthcare solutions. During this pandemic, there was a need to pivot, like almost all companies had to do. COVID changed the world completely. We had to relook at the way we do things and see how we can also get into the whole pandemic prevention side of things. And so that's how come Frontiers Healthcare Services was formed, to primarily tackle this pandemic and help control it.
The Food and Drugs Authority is mandated by Act 851 to ensure that all products that is regulated by it are registered before they can be used. So the device at the airport is classified as a medical device. And as part of registering a medical device, you have to ensure that the device is fit for the purpose that is intended to be used. So if it is trying to find out whether you have a disease or whether there's an organism present, it should be able to do that. So the Food and Drugs Authority's Laboratory Control Department or Laboratory Services Department is the one that does this, and we call it qualification. So you have to make sure that the equipment can perform, and when it is installed, it will give you exactly what it is meant to do. So as part of this, we tested this equipment. And what you do is that you just test it using the manufacturer's standards. Sometimes there's an international standard if that is not available. And for COVID, for example, there is currently not one available. So internationally, it is accepted that you use the manufacturer's standard to test the equipment. So it's called performance qualification, that to make sure that it is performing. And this device, using our ISO accredited laboratory, and our lab is accredited, 17025-2017. So that is the process that we used. So once the equipment was brought in and put on site, We went there and we qualified the equipment, and the equipment is performing as it should. There are acceptable criteria or acceptable standards, and the equipment should be able to detect more than 99%. That is what we call it. So the acceptable criteria is greater than 99%, and this equipment actually met that criteria. So more or less for all instead of even using just the manufacturer standards, we went ahead to use samples from patients that had been done using PCR, negative and positive samples, and we also used that to qualify the equipment, and the equipment passed. So the equipment is up to standard. More or less, it was more or less 100%, but we normally accept a criteria of greater than 99%. So that is how we qualify that equipment.
We think that the antigen test that is currently being done is quite suitable because the antigen test picks up the amount of virus that is present when the person is infectious, as compared to the PCR, which will pick up any RNA that the virus has in the person. So actually, the antigen test has become a very suitable tool for public health screening because it picks up the infection at the time that the person is shedding an appreciable amount of virus, as compared to the PCR, which is very sensitive and will pick up even remnants of the virus when the person is no longer infectious. So the antigen test is actually now being seen as an appropriate tool to screen people out, people who are infectious and actually spreading the virus.
What happens is that when passengers arrive here, they have to go through a payment system. So they are directed from their tunnels right through the payment system. They go to the bank. At the bank area, it is expected of them to go through the immigration forms, either the digital or the manual. Once that is done, they are sent to the banking hall. They go through the payment. And from the banking hall, we have nice ladies who are on protocol, who direct them to whichever glass cubicle or the areas where there are samples, nasopharyngeal swabs will be taken from them. When that is done, there is a courier system where lab scientists take the sample from the place where the samples have been taken into the lab. It is a very restricted area. Windows are open, it goes in, and they receive it inside, and thereafter the processing starts. It is estimated, and rightly so, that within the span of about 20 to 30 minutes, a passenger who arrives in Ghana should have received his report from the lab, and then he receives it from the port health people, and then gets away from here. That is when the person is negative. When the person happens to be positive with the test, antigen test that we're doing here, the person will be taken over by the port health authorities, will be cancelled, and then the next step will be taken. But right here in the lab, what happens is that once samples are taken, the samples go through the COVID testing. We use immunofluorescent technology here. What happens is that it is subjected, and it is a point of care machine. It is not scratch and go. It is a point of care. It takes 12 minutes strictly. Then it produces a result. It is a point of care, and also it's a qualitative test. So it shows you whether it is negative or positive.
From the 1st of September, we eased the airport because airports were closed, all the borders were closed. Luckily, we have only one airport in the country, which is the Kotoka International Airport. So to start bringing back life to normal, allowing our citizens who are outside the country and also people who are coming to do business to come in, then we should find a system where we will not unnecessarily bring people who are potentially infected with coronavirus into the country. You are aware that even recently there's a second wave in Europe and America. So if you are not very careful, we will start what happened in March into this country. What it means is that potentially, if we are not doing these tests at the airport, we have imported people into the country, go into the community and infect the 30 million people in this country. So that is why we are doing that. And when we decided to open the airports, then we said, first, people who are coming or the passengers coming in should be holding a PCR negative test, which has been done within the last 72 hours. We insisted that there should be
a mandatory test at the airport. And if you want to do a mandatory test at the airport, it means you should have a system in place where you can do the test and get the results, and you not unnecessarily put any burden on the passenger to wait. We look at other countries who are doing it. Some people put the passengers into hotels for 24 to 48 hours and do a PCR test. And then some people also allow them to go home and self-quarantine themselves. And I've always been saying that somebody self-quarantine needs a lot of discipline. It's like going to prison. You'll be in your own house, but you cannot even mingle with people who are in the house. So the most important thing that we decided on as a task force is that let's get a test which can be done and done quickly at the airport, and then people can go home. So that they don't go, when we ease up and allow people to come in off chartered flights, they were quarantined in hotels for 14 days. Even with the hotel, the least costs about $50. It means you'll be paying about $700 and you'll still be quarantined. So this is the reason why we got a test, which is you can do it quickly. Within a matter of 30 minutes, the results is done when you reach Port Health. We strengthen Port Health at the same time and make sure that nobody goes away who is positive.
I think our role is key, and the first thing I will say is that we have come to augment the efforts of the Ghana Health Service, the Port Health Services, Ghana Airports Company Limited, in bringing an interruption to this infection. You have to look at put this into perspective. There's a global problem. There was this pandemic going around countries and everybody was trying to find out ways of containing it. It affected businesses, it affected lives, and there was a lockdown. During the lockdown, if people had to come in, they had to be special flights, they had to be quarantined for 2 weeks in a hotel. And I actually experienced that with my family, 2 weeks in a hotel. That cost so much money. So we thought, well, we could come into this space and provide something that would bring interruption of infection and allow people to still affordably come and be connected to family, allow businesses to run, allow international travel to continue. That's what the government wanted to do. And we thought we could come in there with our expertise and support. So our impact, I would say, number one, would be interruption of infection. It takes just one very virulent strain into the country to cause havoc. We've seen that in India, we've seen that in Spain, we've seen that in Brazil, in the US, and other places. It takes just one. And since we came into operation, we are happy to say that we have been able to identify several cases who have been isolated and kept from spreading the infection in our communities. So that's our key role, our key value we bring in interruption of infection and protecting the Ghanaian populace. But apart from that, we have created jobs for lots of people. Frontiers Healthcare Services is young, but have already employed about 350 young Ghanaians. Out of this number, 250 are in full-time employment, and then we have 100 who are, as we call our reserves. They come on local basis because it depends on the numbers, we need more hands. And so these are full-time jobs created in a time when many people have lost their jobs. So it's, I think, a huge achievement, and we are proud of that. But quite apart from that, our supply chain involves lots of SMEs who have gotten jobs in supplying us PPEs, all the masks we use, the gloves, the goggles, and all the supplies are reagents, paper, all these things is business for Ghanaian SMEs. So that's another value we bring on board.
As part of our role as a service, all COVID testing is an integral part of the work that we do. It's part of our testing and tracing and treatment. And so all tests, whether it's at the airport, whether it's in our labs, is part of the work we do. We provide oversight on how the tests are done. We've been part of the establishment of the system and making sure we give us results that are reliable. And we are also receiving the results and interpreting it and following up with patients or passengers who tend to be positive or negative with the information that they need.
Pretty much the testing was very smooth. I really never had any difficulties. Everything was so, strategic. Like it was placed on point.